My name is Sajid Malik from New Media, and we are making a little documentary to get awareness about the coronavirus, which is a big issue at the moment, not only in UK but all over the world.
When I came to this country 41 years ago, I did hospital jobs for 2.5 years, and 35 years I worked in the Elmfield Health Group. And I'm very interested in more than just medicine. It's not about tablets, it's about helping the community, whatever way it helps them. So I'm very, very keen to promote and talk about the truth of coronavirus.
What do you think about the coronavirus? Can you give us a little bit, being a medical professional, background of the coronavirus, what it is?
Okay. The coronavirus is a family of virus. So please don't worry if you've seen the word corona 2 years ago. That was a different corona. These viruses mutate very quickly. This particular virus affects very, very quickly, but 80% of the people have a mild symptoms of breathlessness, like I'll hold my breath now. If you can hold your breath for 10-12 seconds comfortably like this, most likely you don't have coronavirus, you have just a common cough.
Wow.
So please distinguish between corona and the common flu. Common flu, you'll have runny nose, headache and all that. But if you have a persistent cough, but no mucus, that's one worrying sign. And secondly, if you have high temperature. If you've got both, you definitely should isolate yourself. The country is so overwhelmed that don't ring your doctor. The doctor can't see you. Doctors are not seeing you.
True.
They're on the phone only. And also, if you dial 111, they're also overwhelmed. They're also tired. Doctors are also they're tired. So manage it yourself. So the most important thing for corona is not to handshake, not to hug and kiss. Just say Assalamu alaikum, just say namaste, just say hello, whatever you do, but don't touch each other. Stay within bigger distance than you and I are. It should be 8 feet.
Yeah.
But I don't have corona, you don't have corona. So that's the second thing to do. Every time you touch a hard surface like this, the virus survives 10 hours on a hard surface. So if you open your doorknob, come home and wash. And the most important thing is 20 seconds you wash. You sing happy birthday, whatever you do, you wash and wash and wash. So don't touch people, don't touch hard surface. If you cough and don't have a tissue like this and throw it away immediately and wash, then you can cough and sneeze here. Do not wear a mask. A mask does not help. A mask is useful if I'm protecting you from me. I have the corona, I'm protecting you from me. Then a mask is useful. That's one thing. Secondly, the masks people wear are totally useless. They just look good. You need a M95 or something, the thing. But that's a very tough mask. It is made specially for your shape and it's very hard to wear. So don't wear mask. Or if you wear a mask, change it every 2-3 hours. Who's going to do that? So it's no use.
Intensive care units are overwhelmed in Italy. There have been more than 600 deaths there in the past 24 hours alone. The only way to avoid that here, say government scientists, is to keep our strict social distancing controls in place for at least 6 of the next 12 months. That includes school closures, household isolation, and stopping all unnecessary social contact. The scientists are trying to prevent one huge peak of cases of COVID-19 which would overwhelm NHS intensive care units. Instead, there'd be a series of smaller peaks spread out throughout a year. To achieve this, they would suppress and then release the virus by turning the social distancing measures on and off like a tap to control the flow of patients into intensive care.
We're sitting one of the best accountants in the UK. His name is Wajid Ayaz, and he's gonna give us a little bit information about the UK situation due to the coronavirus outbreak.
Basically, it is a very difficult time for all the businesses out there, especially the small and medium-sized businesses are struggling in the leisure, hospitality, in the retail sector. So what we're recommending to the people is you just have to be calm. Central government already have made some announcement regarding grants and the loans, so they just have to wait for the full detail, which will be further coming out next week.
Today I can announce that for the first time in our history, the government is going to step in and help to pay people's wages. We're setting up a new coronavirus job retention scheme. Any employer in the country, small or large, charitable or non-profit, will be eligible for the scheme. Employers will be able to contact HMRC for a grant to cover most of the wages of people who are not working but are furloughed and kept on payroll rather than being laid off. Government grants will cover 80% of the salary of retained workers up to a total of £2,500 a month. That's just above the median income.
Despite the new restrictions and rising death toll, people are maintaining a pragmatic perspective.
It's a bit scary because I drive buses, but I just carry on. I'm just carrying on. I'm not going to let it affect me. I still have to supply for my family.
Also, stay at home as much as you can. Go for walks. I'm not saying avoid people, but go for walks. Avoid people, but go for walks. Home cooking. So Corona is a time for doing good, of being kind to people. Don't buy tons of toilet roll and this and that.
The people are very panicked about the lockdown situation, and they're getting everything, whatever they can get hold of from the supermarkets, and making the shelves empty. What do you think medically? Do they have to do need to get everything together in their homes for next 6 months or years time?
The coronavirus is not going to last that long, and this country is not a country where you'll be allowed to starve to death. That's fact. But people are behaving. The fear factor is so high. It's such a big terrorist, this virus. It's really, would you ever imagine the whole world has shut down?
True.
All aeroplanes have stopped. You barely, if you look on the street, I can't hear any traffic sound. But use the time nicely. Go and help some old people. If someone's shopping and stealing, I would call it stealing, or someone is black marketeering all this at high cost, stand up and say, this is wrong, I won't shop at your shop again. I'm having to shop. So I do that.
What do you think the people are really panic outside? In the supermarkets, shelves are empty, and they're making huge stocks in home, regardless the elderly people, the vulnerable people who don't have enough money to stock the things. What do you think? People really need to stock these things in their homes?
Look, we have numerous time the government have announced to the people, look, they don't have to panic buy. They just have to do their weekly shopping, which they normally do every week. And there'll be enough for everybody. The supply chain is still running. There is no restriction on supply of the goods. The transportation of the trucks and the people in the delivery businesses, they're still running as normal. But what happening is people are just buying like 10 bags of rice or like loo rolls, which is going all over mad, and just people stocking up, and it's making difficult for the elderly people, and they're finding it difficult to buy it. And the most shocking is the prices of all the goods are going up, which probably put more pressure on people on weekly wage.
The pressure was clear when a nurse after a long shift couldn't buy food and pleaded with shoppers not to empty the shelves in a widely watched social media clip.
There's people like me that are going to be looking after you when you're at your lowest. Just stop it, please.
There is one message I want to start with loud and clear this afternoon, which is be responsible when you shop and think of others. Buying more than you need means that others may be left without, and it is making life more difficult for those frontline workers, such as our doctors and nurses and NHS support staff, who are working so hard in such difficult circumstances. So as you shop, think of those who are finishing their late shifts and need to pop to the local shop at the end of a long day.
What do you think, what precautions government is taking to help people in this situation?
Well, government have already taken good precautions. The schools are off from today, and from next week there's no school. Government have already reduced the interest rate. First they've reduced to 0.25, now it's to 0.1%, which is nearly a 0% of the interest rate by the Bank of England. So the government have taken huge steps regarding to prevent this situation. They're offering grants starting from £10,000 to £25,000 for small businesses. There is loans available, which is backed by the government, so up to the 80% value of the loan loan is fully backed by the guarantee by the government, and the scheme is there's no charge. They don't have to pay any fee for that scheme, and government is giving the guarantee for these loans. So with that loans or the grants, the business can pay the wages, pay the rents. So in this sense, government have already taken huge steps. The only thing they can just have a social distance, don't go in big gathering, just try to be sensible, and I strongly recommend, please listen to the government guideline.
And hand washing is best. The other thing, what you call hand gel, is second class. It's not as good as hand washing. Nothing like hot water and soap. The soap actually destroys the surface of the virus. If there's the virus, the soap actually demolishes it, so it dies, and it gets rid of it. So washing is best. So if I went out just now to do shopping, I will touch my letterbox, I will touch my doorknob, I will touch the shopping trolley, I will say hello and touch the counter, and come home and wash. And lastly, do not touch your face. If you touch your eyes, nose, mouth, if you have corona on your hands, don't touch others, but don't touch your orifices like mouth, nose, eyes, because it likes a mucous membrane to go inside you. That's all you have to do, and inshallah we'll be fine in a few weeks' time.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease, because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives. And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home. You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. To ensure compliance with the government's instruction to stay at home, we will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public, excluding people you live with. And we'll stop all social events, including weddings, baptisms and other ceremonies, but excluding funerals. Parks will remain open for exercise, but gatherings will be dispersed. No Prime Minister wants to enact measures like this. I know the damage that this disruption is doing and will do to people's lives, to their businesses and to their jobs. And that's why we've produced a huge and unprecedented programme of support both for workers and for business. And I can assure you that we will keep these restrictions under constant review. We will look again in 3 weeks and relax them if the evidence shows we are able to. But at present, there are just no easy options. The way ahead is hard, and it is still true that many lives will, sadly, be lost. And yet it is also true that there is a clear way through. Day by day, we are strengthening our amazing NHS with 7,500 former clinicians now coming back to the service. With the time you buy by simply staying at home, we are increasing our stocks of equipment. We are accelerating our search for treatments. We're pioneering work on a vaccine. And we are buying millions of testing kits that will enable us to turn the tide on this invisible killer. I want to thank everyone who is working flat out to beat the virus. Everyone from the supermarket staff to the transport workers to the carers to the nurses and doctors on the front line. But in this fight, we can be in no doubt that each and every one of us is directly enlisted. Each and every one of us is now obliged to join together to halt the spread of this disease, to protect our NHS and to save many, many thousands of lives. And I know that as they have in the past, so many times, the people of this country will rise to that challenge and we will come through it stronger than ever. We will beat the coronavirus and we will beat it together. And therefore, I urge you at this moment of national emergency to stay at home, protect our NHS and save lives. Thank you.
Finally, I'm going to ask you, being a professional, being an accountant, how you can help people, because people are really worried about the situation. The jobs are obviously, there's a lot of people that's been coming off on the job, and there's the self-employed, particularly the self-employed people are really worried how they're going to cope their day-to-day expenses, how you can help them.
Look, we at Acumen Accounting have already offered a free advice to all our clients, and if you're not even our clients, we already put a video on our social media page, which is the tagline is "We don't charge talking to people." So if somebody needs to come and speak to us, we're happy to talk, we're happy to help them. Doesn't matter what you do, what kind of business you are in, if you are our existing client or not our existing client, we're happy to help. So Acumen Accounting is there to help you. We'll give you the full detailed information, how you can apply for the grants, how you can apply for the government-backed loan, and if you are self-employed, what is help available. Yes, there is a help, but there's a full details, and we're happy to help them if they want to come to speak to us or if they want to send us a message.
A vaccine could save millions of lives globally. Public Health England scientists at Porton Down in Wiltshire are playing a key role, but it's unlikely to be ready for at least a year.
So this is the time, basically, the viewers, to not get panic. This is the time to help each other, and we will try our best from the media side to update you about the latest information of the United Kingdom situation due to the coronavirus outbreak, and just keep an eye on our YouTube channel, and we will keep posting you the latest situation. Thank you very much.